Did you know using the correct terminology for body parts with your child actually offers health benefits? Most of us have been taught not to mention vulvas and penises in polite conversation, and that's okay. Genitals really don't belong in most conversations. However, proper terminology for genitalia does belong in conversations with children and youth about their health and well-being. In fact, I'll bet you're even wondering what exactly a vulva is. When we call a vagina, we're actually missing most of the genitalia commonly associated with girls and women. In reality, the vulva includes the vagina, as well as the clitoris and labia or lips. The easiest way to teach babies and small children these words is to use them during diapering or bathing when we play games like point to your elbow. I suppose you're still wondering though, how do these words actually protect my child? For one, we need to use the proper language to access healthcare. When we go in for an exam, it's probably not helpful to tell the doctor that my cookie hurts. This is not accurate and may confuse most people who would commonly associate cookies with baking. It would be more accurate to tell your doctor that yes, my labia have been hurting. The next reason for using proper terminology is really creepy, and I won't lie. Research done with inmates who have been convicted of sexual violence against children suggests that children who know the proper names for their genitals are less at risk for an assault. Predators look for vulnerable victims, and unfortunately not knowing the correct terms for your genitalia makes one vulnerable. So with the proper language, children are more likely to accurately report any assault, which is of course a huge deterrent to predators. Before I go any further, it's important to note that victims aren't to blame for anything that happens to them like that, and nor are the parents for teaching their children cutesy names for the genitals. However, this knowledge can help deter predators and lead to successful reporting when the worst does happen. Any tool we can give children to stay safe is a tool worth having. Finally, when we teach children about the genitals in a matter-of-fact way, we are telling them that there is no shame in respectful conversations about them. It means that as they grow older, they know it's okay to take care of their genitals and to get proper medical care and to respect their bodies. It can be a challenge to start using proper terminology like penis and vulva with your children, but it is worth it for their safety and well-being. It's especially even more important if your child is made even more vulnerable by something like a disability. So talk to your child's other caregivers so they too can start using the proper terminology. Not only will this offer some protection to your children, it will empower them to respect all parts of their body.